common cold is caused by a virus. Sinusitis is caused by a bacteria. That's the main difference. Now, the two conditions often have very overlapping symptoms, so sometimes it's hard to tell the difference. In fact, most episodes of sinusitis are actually triggered or caused by a virus. And so initial cold or virus might start out with, a little bit of a runny nose and maybe yellow or green, kind of stuffy, and some facial pressure. Usually that lasts 7 to maybe 10 days. What happens is the virus then causes obstruction of the openings of the sinuses. As a result, the bacteria then settle into the sinuses. The bacteria becomes or infects the sinuses, and a sinus infection develops. Those symptoms that you see with a viral infection, with a cold, then continue or get worse. So the facial pressure, the congestion, and the yellow-green drainage continue past that 7 to 10 day mark, and that's when you typically have a bacterial infection and you need to get treated for an episode of acute sinusitis. At that time, it's wise to see a healthcare professional and consider treatment. So, and these are our next question, obviously, how do you treat sinusitis? Well, a variety of things you can do. One of the things that works for a lot of people, I recommend for everybody who has nasal or sinus problems, is to use saline spray or saline irrigations. A lot of people swear by neti pot, this little tea kettle thing that you use. You can mix up your own. There's a variety of things that people use over the counter. I like people to use what's called Neomed Sinus Rinse. It's easy. It comes in a little squirt bottle with a little salt package. You mix it up, just irrigate your nose. You can use Afrin or neosynephrine. They're decongestant. Topical sprays that decongest the nose, that helps. Oral decongestants like Sudafed, Tylenol, cold and sinus. I like Mucinex D because it helps thin up the mucus. You can use those as long as you don't have any blood pressure or heart problems. And then you probably need to be on antibiotic. Depending on what your antibiotic allergies may be, the first line recommended antibiotic for sinusitis is just amoxicillin. It works great, covers most bacteria. People have allergies to that. An alternative would be for Zithromax. Sometimes if the infection doesn't get better after that, you may need to be a little stronger antibiotic like Augmentin or Levaquin. Those are two to consider after that. Some people will recommend being on a nasal steroid spray, which probably isn't needed, but those things usually take care of most episodes of acute sinusitis.